If only 48% think it's good to great, and then you break
Correct.
down the other half, some are kind of on the fence, and then the last quarter's like, no, it stinks. I think that's probably a lot higher than it was pre-COVID. I think that if there is any, and again, I don't think there's any silver freaking lining, but I try to find silver linings where I can. If there's any silver lining to COVID, we learned how woke and broken our education system is, because parents got to look at the screen and go, what are you teaching my kid? So that was one. And two, millions of Americans are waking up to, maybe I don't need these vaccines. And maybe the big pharma and medical industry doesn't give two you-know-whats about me and my family, just money. So if there's any silver lining, that's two major industries, our education and our healthcare, that need major reform.
What's interesting is they tie those two together with the vaccinations. A child to be admitted to the public full system today needs 80 shots. I mean, it's completely ridiculous. Yeah, one other comment you made in your open is about the 400,000 annual medical errors. My research lines up exactly with what that attorney said. And this is where I would say the best thing people can do is to drop their conventional health insurance, because then you start using your critical thinking. The conventional health insurance, when you add the 400,000 medical malpractice deaths, Dan, to the deaths that are caused by heart disease and cancer, which are number one, number two, medical malpractice number three, that's 1.7 million annual deaths a year directly caused by the medical industrial establishment. These are medical murders, Dan. 1.7 million a year. That's 61% of the annual deaths in the United States are directly a result of the medical industrial complex.